Hello, Nursing 111 students. Today we'll be talking about infection, inflammation, and wound healing. In week 2 clinical, we talked about the chain of infection. If you do not remember the chain of infection, it would be a good time to go back there and refresh your memory because it is important for this conference. Some quick definitions: localized infections versus systemic infections. Localized infections are infections that are restricted to an area or a region of the body. An example of that would be if you cut your finger and that got infected. The systemic infection, on the other hand, is spread to several regions or areas of the body of the host. So, an example of a systemic infection would be the flu. Again, a review from week 2 clinical. Uh, Healthcare associated infections. These are infections that are acquired during your hospital stay through medical care. Common ones are here: catheter associated urinary tract infections, your surgical site infection, your bloodstream infections, and pneumonia. Evidence-based practice in hospital-acquired infection. The CDC states on any given day, 1 in 25 patients have at least one hospital-acquired infection. That is not good. The Joint Commission views this as a patient safety issue and have rules around it. And just for your knowledge, stage 3 or 4 ulcers can be tied to reimbursement, meaning if you develop a stage 3 or stage 4 ulcer during your hospital stay, the hospital may be liable for the entire bill. Defenses against infections. There are 2 different types of defenses against infections: non-specific defenses, which is your normal floras, your body system, and inflammation. We'll go into that. And then specific defenses, which is your immune responses. And we will also go into that. Normal floras. These are microorganisms that are found on your skin and within the deep layers of the skin. They don't usually cause any disease. They help to keep us healthy. They balance with the microorganisms to prevent infection. So they take care of some of these introduced bacteria so you don't get sick. But a disruption in the balance can cause an infection. An example of this is supra-infection. What's a supra-infection? It's caused by the use of broad-spectrum antibiotics for treatment of a certain infection. It eliminates the wide range of normal flora organisms, not those just causing the infection. So it eliminates both the good and bad bacteria and flora. So therefore your body defenses become reduced. And it allows the disease-producing microorganisms to multiply, causing illness. These supra-infections are becoming more common because we are using more antibiotics. So these microorganisms are becoming resistant to them. So we need to create more antibiotics in the near future. You have your body system defenses. These are organs that have unique defenses to fight against infection. The skin, the mouth, the eye, respiratory tract, urinary tract, GI tract, and the vaginal canal. What these things do is they provide barriers or they remove organisms that might cause an infection. Take, for example, your eye, you tear, that will get rid of bacteria. Urinary tract, you wash away microorganisms of the of the lining of the bladder and urethra, things like that. Those are body system defenses. Inflammation. Inflammation is a cellular response to injury, infection, or irritation. It's a protective defense mechanism. And what it tries to do is neutralize or eliminate the pathogens in that area. and it helps to repair the body cells and tissues. Inflammation can be caused by physical agents like mechanical trauma, temperature extremes, and radiation. Chemical agents can cause inflammation, and microorganisms. It's important to know the inflammatory process. At the vascular and cellular responses, you get quick vasodilation. It allows more blood flow near the injury, and that's why it feels warm, because of the blood flow. There's tissue damage and possible necrosis because it releases chemicals that increase the permeability of small blood vessels. Edema forms it from the accumulation of fluid. Because of the permeability of the small blood vessels, fluid rushes in. It's more easier for fluid to rush in. Pain. Since you have all this swelling, which is inflammation, it puts pressure on the nerve endings and causes you pain. And then WBCs, white blood cells, go to the site and pass into the tissues. One of the ways to see if you do have an infection is to look at your white blood cell count and see if that's high. Sometimes when you have an infection, you get what's called inflammatory exudate. It's caused by accumulation of fluid, dead cells, and WCs, so the infection oozes these things out. And they're described in 4 basic ways. First one is serous. It's a clear plasma-like substance that may come out. You may have seen it if you've ever had a second-degree burn. Second one is sanguinous. It contains red blood cells. So basically, if it's bloody red, you would describe it as sanguinous. The other 2 are purulent. This is white blood cells and bacteria that may come out of an inflammatory infection. We refer to it as pus oftentimes, but we should refer to it as purulent in our charting. Then you have serosanguinous, which has a combination of the red blood cells and clear plasma, hence the name serosanguinous, because it's a combination of serous and the sanguinous. It's much lighter than sanguinous exudate. Tissue repair. When injured, the healing involves both defensive, reconstructive, and maturative stages. Basically, the healthy cells have to replace the damaged cells. Granulation tissue is one of it. It's chronic inflammation. It's filled with fragile granulation tissue. It's not as strong as regular tissue cartilage, and it forms scar tissue. But you want to see granulation tissue on wounds because that means it's actually healing. Infection and inflammation definitions. Infection is the invasion of body tissues by disease-forming organisms. Inflammation is the body's biological response to defend itself from these organisms. Keyword here is to remember invasion equals infection. Inflammation is biological response. So let's take a look at inflammation versus infection. Inflammation can be caused by non-living agents, meaning like if you whack your hand against the wall really hard, you'll get some inflammation. That's obviously not caused by some kind of bacteria or agent. But if you do have an infection, inflammation is always present. So you've got to know that. A superimposed infection can occur with inflammation, meaning when you have inflammation, like we said, things can break down, the fluids come through, the cells open up, edema comes, but you may have already in your bloodstream some bacteria which isn't causing an infection, but because of this, it will start an infection. So that is what the superimposed infection is. And like we said before, infection is caused by the invasion of cells by microorganisms, and just the opposite of inflammation is always present with infection. Infection is not always present with inflammation, like we said when banging your head against the wall. This is a nice little chart talking about non-specific defense mechanisms, specific defense mechanisms. We've already talked about non-specific defense mechanisms, which are the normal floras, your body systems, and inflammation. And so you have certain lines of defenses. Like I said, the normal flora is the first line of defense. The second line of defense are macrophages, phagocytes, proteins, inflammatory responses. And then you have specific defense mechanisms. It's adapted immunity, and it's the third line of defense, and we'll talk a little bit about that. Let's talk about immune responses, which is a specific defense, for a minute. They're slower to respond, and the reason is because they're not called into action until the non-specific methods are tried and failed, and the infection starts to become widespread. They're rapid and temporary. It's a third line of defense. It relies on T cells and B cells. Some of those cells produce antibodies, and other of those cells, like the killer T cells, actually kill the pathogen. Let's look at some risk factors that influence infection. Age. As we age, our immune system is not as strong, starts to go down, so you're at higher risk for infection. Also, the very young, their immune system is not developed yet, and that's why when they go to preschool or kindergarten, they all get sick all the time. It's very easy to get an infection, but that helps to build up their immune system. There are certain things that heredity can cause infection. An example of that is diabetes. When you have diabetes, and it's sometimes a heredity disease, you do not have the capacity to heal as well, and you get delayed healing, so you're at higher risk for infection. Stress can cause you to stress makes your immune system go down, again increased likelihood for infection. Certain medications, medication that comes to mind is a steroid. A steroid will lower your defense mechanisms, and it will make you more prone for infection. Nutrition speaks for itself. Poor nutrition, everything in your body doesn't work as well, and you're at risk for infection. And finally, disease or therapies. Things like COPD, diabetes, heart failure, your body just isn't working correctly, and you're at more risk for infection. And therapies like chemo. Chemo reduces your immune system response. The biggest diagnostic test to monitor for infection is white blood cell count. And the MCC standard is 5,000 to 9,000. So your white blood cell count almost always goes up with acute infection, but it will decrease with viral infection. So if you want to find out, like there's two different types of pneumonia, viral pneumonia and bacterial pneumonia. In bacterial pneumonia, your white blood cells are going to increase. They will decrease if you have viral infections, and that's one way to tell what type of pneumonia you have, and also will tell us how to treat it. There's another test which is usually ordered when somebody has an infection. It goes along with the white blood cell test. What it does is white blood cells, there's different types of white blood cells in your plasma, and the different types of cells can tell us different things about infections. So neutrophils, if you see neutrophils, that's high neutrophils tell us that there's an acute bacterial infection, pus-forming infections. So for the infection purposes, it will also tell us if somebody's hemorrhaging or diabetic acidosis, but we're talking about infection here. Basophils, they show an increase in type of blood dyscharias, but in infection, basophils should be normal. Eosinophils can tell us whether there's a parasitic infection or an allergic condition. When you have allergies, outside allergies, your eosinophils will be high. Monocytes are found in some, high monocytes are found in some diseases like Hodgkin's or lipid storage diseases, but for our purposes, the most important thing is you'll see a rise in monocytes when you are recovering from severe infection. So we want a rise in monocytes after an infection. And then last but not least is the lymphocytes, and we can tell if you have high lymphocytes, it's for viral and chronic bacterial infections. So viral infection and chronic infections, your lymphocytes will be high, and there's a bunch of diseases which can also make your lymphocytes high, like lymphocytic leukemia, etc. So, culture and sensitivity test. A urine culture and sensitivity test. It's normally sterile. There's normally no organization growth. If there is presence of infectious microorganism growth, you have an infection. Wound and blood cultures, there's no microorganism growth if you don't have an infection. And obviously there'll be microorganism growth if you do have an infection. Those mostly test bacterial infections. Viral infections usually don't show up on a wound culture and blood culture. So we talked about that in conference this week. So the nursing process in infection inflammation. Culture and sensitivity in urine. So the cultures and sensitivity collection, this is what you have to do. You got to check for the order. You wear clean gloves and you use sterile equipment, meaning the cup inside is sterile, one of those little cups, and you've probably seen them. You got to collect a fresh sample. Usually they ask you to start peeing, then you place the cup underneath your stream of urine, collect a sample, and that reason is because you don't want to get the bacteria that might be on, the tip of your penis or vagina when you first start to pee to show up as an infection. So you want to it's called midstream. So you want to collect it in midstream. You seal it tightly, label it tightly, and then you follow up normal and abnormal results. Wound cultures, we talked about wound cultures in conference, so I'm not going to go too much into it. It's the same thing where they take a sample of the culture and you get back results that say whether what type of bacteria is found in those wounds. It's similar to urine culture, except it's a wound. And then finally, blood cultures. Blood cultures, you take a sample from the bloodstream, and it can tell you what kind of microorganisms have invaded the patient's bloodstream. They can also use blood cultures to figure out, once you figure out the microorganism, which type of antibiotic will help if it is a bacterial infection. So, nursing process, risk for infection, that's a big one. I want you to use your ACLE to review this nursing diagnosis and get used to the ACLE. So how can we reduce the risk for infection? Health promotion, your nutrition, hygiene, immunizations, get your sleep, exercise, all boost the immune system. Acute care, you want to take care of it as quick as possible. When you do start to get an infection, Medical asepsis, remember medical asepsis is not surgical asepsis, but we want to keep things clean. Clean things, and you're not going to get infections. Protect accessible hosts. If someone's on chemo, lots of times they tell them not to go out in big crowds because they don't have the immune system that they had before chemo. Control transmission, and go back to your infection chain of command or infection chain, and stop whichever cycle you can in the chain, like we talked about with the asepsis lecture. Then, of course, isolation and PPE, personal protective equipment. You see this, you put people in isolation hospitals so you don't spread so they don't spread the infection to other patients, and you wear PPE so you don't get the infection from the patient you're taking care of. So just review the rationales for these from the sepsis lecture, which was week 2. Thank you for your time. Have a good day.